Beverly Reed.
And I'm Dr. Amber Klimczak.
And we are Two Peaks in a Pod. All right, well, welcome back, everybody. How's your week been going?
It's been good. We have been busy. I've been doing a lot of surgeries this week.
Yes.
Got a lot of interesting findings on the surgeries, so really happy that we're doing the hysteroscopies that we've been doing.
Yes, I love the hospital that you're operating at. They've had better availability than me, so you've been helping me out with some of my patients too, which I appreciate. So thank you so much. That's amazing.
It's always nice to go in and do a surgery and actually find something.
Yes, I know, because then you find an answer.
Very satisfying.
Information is power. Mm-hmm. Once you have that answer, then we know the best next steps. And we know that a lot of times a surgery like that could be all the difference in our next treatment cycle with a patient.
Absolutely.
Yeah. Okay, I've got a celebrity story for you. Okay, so you know I love Vanderpump Rules. Yes. I've been teaching about Vanderpump Rules. And there is somebody on that show. Her name is Lala. Do you know who Lala is?
No idea.
Okay, very pretty. Mm-hmm. And she actually was married to kind of a famous producer, and they had a child together.
Her name is Lala?
Yeah, I think that's not her real name, but she goes by Lala.
Wait a second, I'm accepting this.
Okay. So she was married to a famous producer, and then he got caught cheating on her, and then they had a very terrible breakup. But they have a baby together, which she loves her baby so much. But she has now come out and said when she's ready for her next baby, she's not going to do anything else except to use a sperm donor. Okay.
Oh, okay.
She says, look, there's such a high chance of it not working out, especially where we live. She lives in LA. Mm-hmm. I'm not taking the chance. Like, I'm so scarred from all of this. Well, there's a swear word that has happened in my life. And she said, I'm doing a sperm donor, period. I will not even attempt to try and do it a different way. I don't want another person involved.
I can understand that. I actually think that's pretty reasonable. I mean, she lives in the world of being a celebrity, right, in LA. And I do think the divorce and separation rates are really high, and it is complicated if you have a child involved. So, I mean, that's actually pretty insightful. I can understand where she's coming from.
Yeah. So I figured today, let's talk all about donor sperm.
Yes. A lot to talk about.
Yeah. Well, I figured first we could talk about who needs a sperm donor. So I guess Lala is an example of a single mother by choice. I love my single mothers by choice group here in DFW. If you're a single mother by choice and you have not connected yet, they have a great social media group. I think they're on Facebook and Instagram and all of those things. Such a good resource and just a lot of support for each other, which I think is great.
Patients that I need to get plugged in.
Yeah. What I love is some of them have connected there, and they've used the same sperm donor so that they call them diblings, donor siblings, and then that way they can kind of meet up and all that. So I love that.
That is really fun.
Yeah. And then, okay, some other people who may need to use a sperm donor would be our same-sex couples, right? Mm-hmm. Yep.
And then definitely sometimes we have couples who are male-female, but maybe for some reason their partner has had a vasectomy and, can't get it reversed or try to get it reversed and didn't work properly. Or they are what we call azoospermic, meaning they don't make any sperm at all. And so then we recommend using a sperm donor. We're going to think what other situations to use donor sperm.
I think that pretty much covers it. I guess maybe this, sometimes if somebody has tried IVF a lot and the sperm is not working, sometimes I've seen them almost use donor sperm as a diagnostic approach, meaning that when they do IVF, we take the eggs out. Sometimes they'll fertilize half the eggs with their partner sperm and then half the eggs with donor sperm and compare the outcomes to really try to understand when their IVF is not working. Is it more of an egg problem or is it a sperm problem? Sometimes that kind of lets you figure that out. So
I will say in my experience when we've done that in the past with the lab, it does always seem to be that not just that it's sperm, but it's that the egg doesn't have the ability to kind of also fertilize and make an early embryo. So it tends to be on the eggs as well. It's interesting. I always want to blame the sperm. I don't know why. It's just like one time I want it to be the sperm.
Or sometimes it can be both. I know. It's actually one of my sweet patients the other day. We did all their testing and the semen analysis came back amazing. And she was mad about it. She was like, of course it's amazing. So I understand. I get it. Okay. Well, let's talk about whenever you're seeing your patient that has told you they want to use a sperm donor, do you have any kind of special pre-screening or pre-testing that you recommend for them?
Yeah, absolutely. So I usually just go over the process with them and then talk about some of the labs that we're going to do. So we've talked about this on our podcast before, but one thing that we do recommend and at least offer to all of our patients that are interested in using donor sperm is something called genetic carrier screening. And that's really where we take a sample. We actually do it with a saliva sample, and we screen you for hidden or recessive genes that you may be carrying that could potentially come together with another gene from your donor sperm and make a sick child. And, like we've said before, a lot of the donor sperm candidates have already been screened, so you know what they carry. You can see and find someone that you don't match up on. The idea is if you carry a gene, you want to find a donor that does not have that same gene, so there's no risk for your child, because you basically need 2 copies to get sick with these recessive or hidden genes. So definitely that's what we offer. And then we also want to test for something called CMV, or cytomegalovirus. It is an infection that you may or may not have had previously in your life. I'm told it's kind of flu-like, but a lot of people just don't remember getting it. I think I have had it before and never knew. So most of the time what happens is we check your blood and we find out you're either CMV positive, meaning that you have been infected previously and you have some immunity to it, or you're CMV negative, meaning you've never been infected with it and you don't have any immunity. And the theoretical risk is that if you use a sperm donor that potentially has had CMV in the past and you haven't, that he can infect you, or you could have, problems with the pregnancy, things like that down the road. So you want to match with your sperm donor if you're CMV negative. You want a CMV negative sperm donor. If you're CMV positive, you can actually use a CMV negative or CMV positive donor.
Yeah, absolutely. Well, I have to say, I'll kind of tell you too, where I'm a little annoyed with CMV testing. The government makes us do it. Okay. Yeah. But I will say, in real life, they've never actually had even one reported case of somebody getting CMV from a sperm donor.
It's a theoretical risk.
It is out of an abundance of caution, because if you were to get CMV while pregnant, sure, that's the concern. It can cause birth defects or something like that. So, I do get that. I understand it. But it's hard because it is just additional legwork that the patient has to go through. It's an additional test they have to do and all of that. And I think it's kind of funny because this is one of the few tests that you get that you want to be positive for.
That's true.
Because if you're positive, you can really use anyone. But if you're negative, you just lost your chance at half the donor. It's such a common virus that about half the donors have it. So, but of course we follow the rules. We definitely do. But, that's just kind of a side note that I'm just like, I don't know that it's,
And you always kind of wonder, like, how many couples are out there in the real world where they're not,
that's a good point.
Yes. Positive ones. Absolutely. I'm sure that happens all the time and we're not screening or paying attention to that.
That's a really good point. Yeah. But, and then I just wanted to circle back to the genetic carrier screening, where I do think it's just so amazing. I really do highly recommend it in these cases, because you get the luxury. Like, it's different when we have a couple coming in, because if they both carry the same thing, I can't just say, well, find a new partner. But in this case, I can say, just find a different donor, because all sperm banks that I know and use do genetic carrier screening on their sperm donors. Now, I will say it's a little bit difficult because sometimes they make you pay more to find out the results. So, for example, if you look on a sperm bank website, a lot of times they'll tell you the basic information for the sperm donor, but then they'll be like, but if you want to see their genetic carrier screening results, then you pay this extra fee. But I will say some strategies are, let's say you did the genetic carrier screening, you came back negative for everything, then really you don't have to know what he carries, because you would both have to carry it to pass it on to a child. But I know some people will still pay to unlock it, because that way they can at least just tell their child, hey, just so you know, this runs in our family. You don't have this condition, but you have the possibility of being a carrier for it, since the sperm donor was a carrier for it. So I think it's really helpful to do it. I think the other strategy, though, is if you happen to find a sperm donor who is negative for everything. I will just say it's hard to find somebody who's negative for everything, though, because at this point, they're testing for so many different genes that you're probably going to be positive for something. Like, there's not very many of us walking around that have perfect genes.
Every once in a while, my patients come back completely negative. I'm like, oh, you're really clean.
That's right. Yeah. So I definitely think that is one of the luxuries of using a sperm donor is you get all the options, you get all of the choices and everything too. Okay, do you have a favorite sperm bank that you recommend for your patients?
Well, we've been using the local one, I guess, in Arlington a lot, and it's just been easy for our patients, and now they know us, and they're able to, just move the sperm here easily. They come up and pick up their tank. So I will say out of ease, that would probably be my favorite. But we always offer the 3 that I send the same email every time to everyone to choose from the 3. And I like what's your thing?
I stole this from my old boss, who he used to always tell patients that, so Fairfax and Austin has the smartest donors. And then California Cryobank in California has the widest selection. And then Cryobank of America is nice because it's local, free shipping and convenience and all the rest of it. But there's a lot more out there too that I didn't mention. I think there's Seattle Sperm Bank. Is it something that starts with a Z or an X or something? But anyways, I mean, we can work with any of them. It doesn't really matter to us, I think, which one you use. And we've had good pregnancies from all of them as well. So I think it's really it's kind of nice to be able to browse all of them and just kind of find someone that you connect with. I will say some of them are really cool. It's kind of fun. Sometimes they'll bring in the brochures, and the girls and I will pick out a sperm donor for ourselves just in case.
The baby pictures. That's very interesting to me. And I guess there's always donors that have like a really cute baby picture, and their sperm gets used so quickly.
Yes. Well, but some of them you can maybe pay higher fees to get to see adult photos, or there was one sperm bank, I can't remember who it was, but it was interesting because you could upload a photo of your partner to try to get the computer to match up somebody who looks like your partner. This is for same-sex couples or for heterosexual couples, either one. So I think that is kind of a cool option. Or you can even try to get ones that look like a celebrity. Like I remember there was like a Brad Pitt option.
Oh my gosh.
So it's actually kind of fun to see all the different options that are available these days. But I wanted to kind of use this as a good point to talk about the differences between using an anonymous sperm donor versus a known donor. Because I know one of the top things I'll have is somebody will come in wanting to use a friend they have or something like that. Have you ever had that come up?
Yes. We rarely proceed that way,
right. And same. And so I figured I'll kind of go through, why that is. And I definitely understand why people would want to do it. A lot of people will share with me, well, this person is a close family friend, and I would really like them to be involved with the baby as the baby grows up and everything. But there are a lot of things to consider. So I think probably the biggest thing that people don't realize, it is actually takes longer and is way more expensive to use a known donor rather than an anonymous donor. So what the government usually, because they get involved in these type of cycles, they require for safety that a sperm donor would get some blood work drawn and donate the sperm, but then you have to quarantine that sperm, which means keep it frozen for about 6 months, and then you repeat all that infectious disease testing. So that is a way of making sure that the sperm is free from infection. And the reason they do that is their concern is, what if somebody, for example, got HIV, but they just got it a week before, so the levels were so low that it's not going to show up on a blood test, right? And so they fear that could be the case, and that's why they say recheck it 6 months from when the sperm was given to make sure that that HIV test would still be negative and that the patient wouldn't be at risk for getting any kind of infection from using the sperm donor. But think about the cost of all of that, right? You have to pay the place to, freeze the sperm, to do all the blood work and everything. And then you have to wait all that time. And so that's always a big, yeah. Like usually when people see me, they're ready. They're like, no, I want to do this next month, right?
Yeah.
And so I think most of them, when they find all that out, that really makes them change their mind. And then the other thing is legal. Legal is very expensive, costs thousands of dollars as well, because you really don't want to get yourself in a bad situation. If you don't have a legal contract sorted out, number one, the person who gives you the sperm can actually be able to get custody of your child and could be on the hook for child support too. And so these things really need to be worked out legally before you do anything like that. So
it always seems straightforward.
Yeah, right.
And then it never is.
Yeah. And I guess I'll have to tell you too, I've been kind of surprised. I don't know if you're aware, but there are these apps these days, or even Facebook groups, where sometimes people will try to find their own sperm donors just themselves. So they don't go through a clinic, they don't go through a sperm bank or anything. And I was really alarmed. So for example, in the Facebook group, they'll post, can anyone donate sperm? And somebody will say, I'll donate sperm.
Oh gosh.
And I told my patient, I'm like, this is not safe. I'm like, aren't you afraid of getting a sexually transmitted infection or something? And some of them will, order like a little kit on Amazon to inject the sperm, or some of them do it, they call it the natural way even. And I'm like, oh my gosh, no, like don't.
The natural way.
Yes, like intercourse. Yes. And I'm like, and I'm like, aren't you concerned these people may be donating to multiple people? And she said, well, he did go to get his labs drawn, and he posted a photo of his labs on the Facebook group. And I'm like, yeah, but his labs could have been negative a month ago, and now they could be positive. And so, of course, we completely recommend against that. It does make me sad that people feel like they need to go to those lengths. Because I do understand there can be a lot of things you have to do. Like if you come to the clinic, you have to have a blood test and all the rest of it. But please don't do that.
It's not worth it.
Yeah, yeah. So yeah, it's good for you to know those apps and Facebook groups are out there. We do not recommend them.
No. Maybe for dating. Not for your sperm donor.
Okay, so I also wanted to know, how we have our test, the HSG. This is a dye test to see if the fallopian tubes are open. I wanted to get your thoughts on, do you require that patients have this test before they try to do a donor sperm insemination?
I don't require it. Mm-hmm. I do always counsel my patients about the utility for it. And I really take like a close history from them to see, is there anything that really stands out to me in their history that would make me suspicious that they may have some fallopian tube dysfunction. For example, we know having a history of a sexually transmitted infection puts you at risk of having tubal dysfunction. Things like chlamydia are really common. They can damage your fallopian tubes and makes them kind of scar closed so that they don't function properly. Having really painful periods, kind of signs that you may be having endometriosis, something like that that's causing scarring in your abdomen. Or having like a really big surgery that is known to cause adhesions in your abdomen. For example, people that have a ruptured appendix and had surgery for it always kind of makes me suspicious that something may be going on with their tubes. And I really encourage those people to try and get an HSG prior to moving forward, because like you saw, it is a little bit of legwork.
Yeah.
And, we can try several times and then ultimately tubes aren't open, it was kind of all a waste.
Yes, exactly. And, even though using an anonymous sperm donor is more affordable than using a known sperm donor, it's still expensive. Right. So, just so people know kind of a range, usually it's about $600 to $1,000 per vial of sperm that you purchase. Usually you need one vial of sperm every time you try. And so I do think that would be really heartbreaking for somebody to have maybe tried multiple times and then find out later, oh wait, your tubes were blocked the whole time and it didn't even have a chance of working. I do know that there are actually many clinics who require that you have an HSG test before doing donor sperm insemination, but I actually align more with you on this one because really, honestly, I hate to require anything. Like, I really think women should be able to choose in most cases what they want to do. And especially too, if it's somebody who doesn't have a history of infertility, somebody, a same-sex couple or a single mother by choice who it's not like they've been trying to get pregnant and can't get pregnant. It's certainly reasonable for them to try an IUI. without having done an HSG. So I do the same thing. I offer an HSG. I'm like, hey, this is available for you if you want to do it, but I definitely don't require it. I do more highly recommend it if, let's say, we try our first cycle and it's not working. Then I'm like, hey, let's really go ahead and just look into this, because I just want to try to help them figure out why it may not have worked the first time. But I do think it's important too to just kind of talk about ballpark success rates for doing an insemination, because I know before I learned about fertility, I would have actually assumed the success rates were much higher.
That's true. Yeah, I can imagine that. Well, it really all goes back to natural human fecundity, right? Yeah. And that's something that I try and cover with all my patients. And it's just important to understand that humans are really inefficient at getting pregnant. I always tell my patients, we're not bunnies. It's just the way we are. And so the natural human fecundity rate is 20% each month. So that means, like, really, if everything's working as it should, your chances of getting pregnant each month are only about 20%. So there is no treatment or no really scenario other than IVF that gives us a higher chance of success per month than natural rates of human fecundity. Yeah. And I just think it's so helpful to just mentally prepare for the fact that, hey, if our chances are about 20%, it's not totally out of the ballpark here to just plan for having to do multiple cycles to have a good chance at reaching your goal. Right. But I think that brings up a good point then, which is how many vials of sperm should somebody purchase whenever they're going to be doing donor sperm insemination? Do you have a guideline to give them? And I have some patients that don't mind just like ordering it for it like one by one. Yeah. But they do tend to pick donors where they know there's a lot of sperm available. Yeah. It makes me nervous when it's a limited supply. And then I'm like, someone else is going to order up that sperm, and then you're not going to have the sperm that you want available. And some people, if they've already had a child from donor sperm, they want to make sure that they get as many as possible to have success and have the same sperm donor for both of their children. So there's a lot that kind of plays into it. But, you know, I think 6 IUIs is reasonable to like put in your mind. I always say to patients, okay, this is like, we're setting the clock, we're trying for the first time. Because a lot of these patients, like you're saying, they're not infertile, they haven't been trying, right? So, you know, no one's going to give up after like 1 or 2 months and say, okay, it doesn't work. You know, I'm not getting pregnant. It's been 1 month. It's been 2 months. So I think 6 is a reasonable number. And I would say that's 6 vials if you want to be certain, you know, but I would say most of my patients just order it each month. Yeah. Most of mine just do each month too. But I do always say, look, do you think it'll be important to your future self to have a sibling for your baby with the same sperm? And if so, you should probably get some more available, because I will tell you, sometimes I've seen crazy things happen. I remember I had a patient who had checked the sperm bank and they had said, we have 17 vials of sperm. And great. Okay. They felt like this donor has a lot. If we get pregnant, we'll buy some more vials. So she got pregnant through our treatment, and then she called to say, I want to purchase some more vials for the future. And they said, oh, sorry, somebody else got pregnant with the sperm and wiped us out. They purchased all 17 vials of sperm. And I was like, who buys 17 vials of sperm? Like, first of all, that's a lot of money. If it's $1,000 a vial, that's $17,000. Wow. Like, who does that? And we kind of had to really beg the sperm bank. Actually, they were nice and they worked with us to be like, can they give us like one? Did they? You know, yes, they did actually work with us. Yeah. Because they were like, yeah, this patient's not going to need 17 vials of sperm. I wonder if they were trying to make it so that no one else could use that. I think so. They wanted it just for their child. I think so. But that kind of taught me like, oh, you really have to get, because I would have, you know, told the patient, oh, you have 17 vials, you have nothing to worry about. But who knew? Yeah. So. And there wasn't like obviously anything that came to be like wrong with the donor. No. So that's the other thing I wonder is like if they pull the sperm or something. No. It was that somebody else had purchased all the vials because they wanted this for themselves. Exactly. Yeah. Okay, well, should we wrap it up for the week? Yeah. Okay, good. Great discussion. All right. Well, thank you guys. Hope you all have a good week. Bye.